So when I do my brow lift, I want my incision to be irregular and undulating, and I want it 5 to 8 millimeters behind the true hairline. So not these little thin vellus hairs, but the true hairline. And I'll just make some little zigzags here. And as I come laterally, I want to make sure I stay in the hairline. Now, in terms of the actual brow lift, basically it's at the junction of the central and lateral third. And I can look at this and just figure out where the best place is to elevate that brow, and it's going to be right there. And we'll go to this side. And sometimes that corresponds with the lateral limbus. So that's what we'll keep in mind, and we will extend these up top. So when we're looking down on the patient, we can see a straight line for our elevation. All right, now we're going to mark our sensory nerves. So we're going to do a midline mark, and 17 millimeters from the midline is the supratrochlear nerve on each side. Reset that to 10, and then 27 millimeters from the midline is, so it's 17 and 10 is 27, and that is the supraorbital nerve. So we'll just make little nerve squiggles here, and this will help us remember that we're in that area of the nerve. Okay, so those are our basic markings. In this situation, we have pretty significant lateral hooding, so we'll be dissecting out about this far, but we won't be going to the temporal crest. We're going to mark her eyelids now, and I've already put a little dot on her crease, which is 11 millimeters, which is about normal, about where I like to be, and I lift that brow up a little bit to measure that. Now, if we were doing a regular blepharoplasty without a brow lift, then we would be removing a lot of skin here, okay? Hold her brow up there a little bit. But since we're doing the brow lift, we're going to remove far less skin. Okay, let go. And now what we're going to do here is just mark our crease. And our crease has to be exactly the same on both sides. Lift it up again. This measurement, however, will be variable. And another thing that you don't have to do is you don't have to turn up this upsweep, because we're going to be elevating the brow, and we're not going to have to worry about hooding. So this is going to be our approximate line. And for beginners, you probably shouldn't do both of these procedures at the same time. So again, you can see we'd be taking far more skin if we weren't doing the brow lift. So in marking our neck, we want to mark our midlines, and I've done it down from the lips. And I'm going to find her crease. My assistant's going to hold a mirror under here, which will give me some light, and I want to make a straight line right at her crease, and I'll probably make my incision, you can move the mirror now, just a little bit under that crease. If I was using a chin implant, I would have to go further. And while we're here, put your chin down here, okay? We're going to mark some areas of fat distribution. Okay, I want you to go like this once. Put your chin up and do that. Okay, she doesn't have any significant platysma banding there. All right, very good. Now, the next thing we're going to do is we're going to mark her jowls. And it's important to mark the part that is under the mandible as well. So if this is our jowl, that part is under the mandible. Are you able to see that? Mm-hmm. Okay, very good. Now we'll proceed to our preauricular incision. So I like to do what I call a triarcuate incision. So it's going to be 1, 2, 3 arcs here, okay? And then my sideburn, the sideburn has to be at least on a line from the lateral canthus, all right? On this patient, I have a lot of leeway, so I will make a marking up here. And the junction of these marks are usually behind the helical attachment. Then I'm going to come back here. I'm going to go to the widest part of the pinna, which is there to there, and pull it back. And I'm going to make my incision straight out and angle down. I'm going to put this incision in the center of the sulcus and come around and meet my earlobe incision, okay? And this has a slight curve. Now, if I was going to do a retrotragal incision, I would make my mark back there. When you make these anterior incisions, that's why I like to really stretch the skin and then push down hard with the pen, and it will fall right in to where you want it. And if you're doing a traditional deep plane facelift, you want to mark from the angle to the zygoma, and this is roughly the vector you're going to follow. So your skin dissection will be here, and then your deep plane dissection will start there and proceed anteriorly.